not healthy. And so we opened up our doors to that particular approach to OBGYN. So for you medical students in the audience who are pro-life, I want you to say that you don't have to hang your conscience at the door when you go work in OBGYN, even though that's what the world's telling us, right? The American College of OBGYN, in one of their committee bulletins, come on in, has said you either have to do it or refer for it. Yeah, come on in, please.
I'm just seeing
Okay.
if there's more.
Sure.
Hold on. Can you raise your hand if there's an empty seat beside you? Okay, so 1, 2, 3. 2. Okay, awesome. Thank you.
Thank you. No, that's no problem. So once again, here I am trying to discern my way through this. I wanted to practice excellent medicine. And the way you do that is you offer real options to women other than abortion. You walk them through. Remember, in medicine, you hate the disease, you love the patient. In medicine today, you hate the disease and you love the patient. We believe health is based on the relationships found in community. We believe that the relationship between mom and her fetus, mom and her unborn baby, is the primary relationship, not only for the person, but for society. That relationship, that give and taking, that sacrifice. And we believe in medicine today that you can love enough that you make abortion unthinkable. Because remember, we don't throw stones at people. We literally meet women where they are. And so the Tepeyac Family Center in Northern Virginia and Divine Mercy Care, we wanted to provide a real alternative. So we opened our doors to the pregnancy centers. We said, guys, gals, listen, come to us. We'll see you. If you're going to choose an abortion because you can't pay for it, or if someone's going to kick you out of the house, we'll try to help you. We'll walk you through this process. And they came. And we said, we're going to be a for-profit practice, we're going to run it real smooth, and we're going to see you out of our margin. Well, what happens in medicine today? Reimbursements drop, malpractice rises, and your margin shrinks. And my accountant told us, you have to stop seeing the poor. I believe in social justice. I believe in giving back to my community. I believe in working with the community to take care of the least of our brothers and sisters. I believe it. It's a real, social justice is real. But I also believe in the right to life and providing real alternatives as a doctor. Because I did it on the other side, I can't do it anymore. I didn't find happiness, I found sadness. I found fear and anger and bitterness. It was really tough. So now we opened up this center and people come in droves. Because there's a higher rise of women, because I'm a gynecologist, so I'm saying women, they're coming because they want to come to a practice that would not abort their child. It's their conscience right as a patient. It's interesting about conscience rights. They look at the pro-life community and they say, you pregnancy centers, you have to put a note on your door that says, we don't provide abortion services. But they don't flip it around and say, oh, you doctors, oh, you clinics, we provide abortions, but we provide very few adoptions. Or, I'm a doctor and I need to set up my shop and say, I do 10 abortions a year. I do 20. I don't do any. There's kind of this double standard. And so what's happening is that this conscience issue is real crucial. It affects all of us. Because as the president talks about, when you're being attacked, when people misunderstand you, especially on an ethical issue, especially on a faith-based issue, you must be true to your conscience and you must be true to your God. That's what he said at the prayer breakfast. And once again, I respect his desire to help folks. I truly do. And so here you are, you're listening to patients, you find a better way, and now patients are coming in droves, and now they're referring patients to us. So we practice excellent medicine, we see the underserved, and we are pro-life. As you work through this, more doctors are now coming to us. And so what happens is that we now have 5 full-time docs, 1 part-time, 1 nurse practitioner. We do about 700 deliveries a year. over 110 of those are to women in crisis pregnancies because we opened our doors to the women in crisis. We have pro-choice people coming to our practice because we do good medicine. I do good alternative medicine. I do good hormones. We may disagree on some issues, but you know what? It's respected. And that's all I'm asking for here. I'm not talking about throwing stones at people. I want a seat at the table. I want a seat in the community, and let the marketplace decide where people come. And let all people live their conscience, both patients and providers. So, we went nonprofit after about 10 years in business. The margin was getting lower and lower and lower, and our malpractice premiums went from $40K per doctor per year to $110,000 per doctor per year. We had 4 doctors at $160,000. The bill went up to over $450,000. The community did a telethon for us one weekend, and they raised $270,000 for our little office. I wanted to cry. And it made me realize that being a part of your community is very important. Yes, the federal government can help, but they have no idea what goes on at the local community level. Now we're a nonprofit company. Divine Mercy Care is the charitable umbrella of our Tepeyac Family Center. We partner with governmental agencies. We partner with church groups. We partner with the Fairfax Health Department. Because remember, we see there's a lot of illegals in our area, and they're being kicked out of the clinic system, and they can't make their bills meet, and so they're sending them to people like us in the community. And so this model of healthcare that we're developing is kind of a hybrid. Yes, we take insurance. Yes, we see all people. We want to mix it in a private practice setting. So many of us go on mission trips to Haiti. I went to Appalachia. When I left there, because I spent 3 months, this young woman looked at me and said, "John, thanks for coming, but I guess we're not good enough to keep you." I said, "What do you mean?" She says, "Well, why aren't you staying with me?" I said, "Well, I've got to go back." She says, "Well, why? We love you here. We would love to keep you here. I guess you came like all the rest to satisfy something in your conscience, to give back. Thank you for that, but in the end, we'd really love you to stay." Man, it went right through my heart. Right through my heart. So this idea of social justice, not working at a free clinic, which I respect and love, but this idea of merging the two together. So in our office, you can see a senator and a stripper sitting next to each other. You can engage that critical, right-wing, Christian, how can she come here? Because she wants great health care just like you. It's fascinating. It's fascinating to be in this. So I found joy, and my patients have found joy, and we're serving the community. And we're trying to work with the abortion clinics in the area. You have a woman who's on the table and she's panicking, send them to us. We'll walk her through. This is the exciting piece. Because we're trying to provide a real alternative right now, because the federal government, they're going to argue this point left and right about health care, and come on. The churches, they won't touch it. That's too much of a hot potato. My profession, they're just trying to get by because it's really hard out there today in medicine. So I want to leave you in the next 5 minutes with these points. These are my closing points, and then we can open up to questions. And we can really kind of make this more engaging. A, for all you medical students who believe in the right to life, you might feel alienated. You might feel alone and isolated. I know that when I was growing up, most of my patients, most of my friends were, yeah, I'm pro-life, but I couldn't, I just couldn't force that opinion on someone else. Or they were, no, I believe in the right to abortion. In medicine today, most OBGYN departments are that same ilk. And in fact, most of my peers that work with me have said things like this. you know, Dr. Marie, you should have left your conscience at the door when you joined. Or, Dr. Lorna, no, you really should have thought about that before you became an OBGYN. They're trying to tell us that because we don't provide abortion services, we shouldn't be an OBGYN. And I'm here to tell you that that's absolutely wrong. Because I don't think abortion is good medicine. I think the data is going to back that up, and I think more and more people are coming to places where they don't want a doctor who's going to terminate a pregnancy just because they wanted it. So for instance, in our office now at the Tepeyac Center, we have something called the perinatal hospice program. That if you have a child that's sick, that is incompatible with life, we don't offer an early delivery or termination. We try to encourage the mom and dad to let the baby live as long as it'll live, so you can maximize your time with a sick child. Life is full of challenges. Life is not perfect. And you know what? People are now coming for our service because we're giving this as an option at the local hospitals. Many, many, many mothers don't want to end the life of their sick child immediately. They want options given. So by being in the community and by practicing pro-life OBGYN or medicine, you're actually increasing choice. You're actually increasing options. And you can do it in a way that's practical and serving and is very fulfilling. So one is, I know you might feel alienated and isolated, but you're not alone. Number two, get the facts. These studies that I quoted, oh, come on in. These studies that I quoted, they're available. The APLOG, the American Association of Pro-Life OBGYNs, Students for Life, Feminists for Life. They have some wonderful, wonderful, I think there's a chair somewhere here. Get the facts, because there are a lot of good studies out there that talk about, look at the data, look at what ACOG says, look at what other people say, and just kind of weigh it yourself. Don't take my word for it, look at it yourself, be critical. Mentorships. There are docs out there in the community. Just like when I was learning how to do terminations, I went to go with a good provider. It's the same way with pro-life medicine. There are people out there. You can contact divinemercycare.org, our association. Call your pregnancy center. They may know of a pro-life doctor in your community. Go be with them. See what it's like. See if what you thought was real. See if they're happy. See if they're joyful. See what type of patients they see. When people come to our office, when we opened it up, we got 2 students one year. This summer, I think we had 13 to 15. We are now getting 18 to 20 this coming summer. They're coming all over because they want to be an integrated, holistic doctor in a community, and once again, to do it in a very vital way, serving the whole person, the whole family. Because once again, I don't think abortion is good health care. I truly don't. And we're trying to find real options. So get the facts, get a mentorship, work at a pregnancy center, volunteer at a pregnancy center. It was the best experience for me because while I was terminating first and second trimesters for any reason, I was then watching people struggling through a crisis pregnancy. And people were being met, not coerced. Good discussion. So if you have an opportunity to volunteer some time at a pregnancy center, do so. Even if you were pro-choice, do so. I think it's a good experience. And then lastly, remember that medicine is all about relationships. It's all about listening to patients. It's all about good science mixing with that do no harm ethic and trying to see those who are less fortunate than you are, people falling between the cracks. At Divine Mercy Care at the Tepeyac Family Center, we don't believe that remember, we hate the disease, love the patient. We don't get rid of the disease by killing the patient. You know, one of the comments that I heard, and I heard this up at Charlottesville, is that the reason why there's so much higher depression and suicide and substance abuse is that the women who go have abortions are disproportionately more poor.